Well, Bennett Kessler filed this following report. According to informed sources outside town government, Mammoth Town Manager Dave Wilbrecht sent a letter to the town employees group that some call a thinly veiled threat to outsource town jobs unless workers give up a lot more money. The point of threat is a paragraph that says basically that if employees agree on sustainable savings, end quote, contracting out their jobs may not be necessary. Now, Wilbrecht's letter invites employees to meet with him as soon as possible to identify additional cost savings, reduction of salaries, benefits, and greater contributions to pensions by employees. The Town Employees Group, which is represented by the American Federation of State, County, and Municipal Employees, has a signed contract with the town of Mammoth through 2016. Now, in the last 4 or 5 years, workers have made several amendments to their contract to reduce salaries and make their own payments into pensions, resulting in cuts of more than 20%. Now, Town Administrative Services Director Mariana Marashiva Martinez had mentioned the potential for outsourcing jobs in her repeated discussions over the past few months on restructuring town government to balance the budget and make the $2 million annual payments to Mammoth Lake's land acquisition. But the concept of outsourcing government jobs has come under serious scrutiny by courts. In late November, the California Supreme Court ruled against the city of Costa Mesa's attempt to lay off more than 100 city employees and outsource their jobs to the private sector. Now, according to reports, the Costa Mesa City Council, a majority, sent out more than 200 pink slips as part of a plan to privatize city services. Now, from Superior Court to Appellate Court and finally the California Supreme Court, judges rejected the city's request to overturn an injunction blocking their outsourcing efforts. Now asked to comment on reports that some see Wilbrecht's letter as a threat to outsource town jobs, Administrative Services Director Martinez said, quote, "I can see why they might see it that way. We want to be as open as possible within contract negotiations," end quote. Now, Martinez said that outsourcing is a matter of legality and common sense and that the town has to work closely with the Employees Association. Now, Martinez said the town ultimately has two goals: to achieve the lowest per employee cost and the most efficient services. Martinez said, quote, "If we can achieve this by working with the association and not outsourcing, I don't see why we would outsource," end quote. Now, she said the employees have already proved to be creative and willing to work with town management. Now, when asked how the town can even discuss outsourcing when employees have a signed contract to 2016, Martinez said discussions need to take place. She said, quote, "We need to look at expenses. We are aware of the legal boundaries," end quote. Now, Martinez said management would meet with workers later this week, and she said there would be a roundtable discussion with workers and local partners regarding volunteer programs and outsourcing ways to reduce costs. Martinez also said the town needs to discuss with employees and the public what services should be candidates for outsourcing and then do further research. She repeated, "I understand the employees' fear. We're trying to develop a process for all to participate to reshape the community," end quote. Now, behind the scenes, some workers and members of the public point to Martinez's new contract, which officials have now confirmed costs roughly $245,000 per year, while at the same time, workers are asked to give up more. The town council plans to vote on the restructuring plan that includes the cuts of employee positions and other items when they meet tonight in a town council meeting. Now, Martinez said in later phases of the restructuring, officials will look at, quote, "alternate service delivery models," end quote. She said this assumes the number of workers at that point would remain the same. Said Martinez, "The only way out is to reduce costs." The town has posted a supplemental report that will be presented at tonight's town council meeting as part of the restructuring plan, and that report can be viewed on the town's website, which is ci.mammoth-lakes.ca.us. Well, Bennett Kessler also filed this report. In early November, Mono County Sheriff Rick Scholl confirmed reports that he would retire in December. He had said that he would now put family first. Sheriff Scholl term continues into 2014, and his undersheriff confirms that the Mono County Board of Supervisors will vote to appoint him to fill that spot. Now, the Mono supervisors discussed appointment of a sheriff at their meeting Tuesday. When asked about his possible appointment, Undersheriff Ralph Obenberger said that the supervisors, quote, discussed it as an agenda item, and the actual vote will be next Tuesday, with the swearing in to be immediately following, end quote. Now, Obenberger said all of the board members favored him, his finishing out the sheriff's term through 2014. Obenberger would take over the position of sheriff at current Sheriff Scholl's retirement, which is December 20th. The seat would then go up for election at the end of the term. Asked how he might fill the vacancy of undersheriff, Obenberger said, quote, I advised the board that if I received their appointment to finish out the term, my intention would be to promote Lieutenant Robert Weber. Now, according to the Mono Sheriff's website, Undersheriff Ralph Obenberger began his law enforcement career in 1985 with the Los Angeles County Sheriff's Department. In the year 2000, he moved his family up to Mono County and started his Mono County career as a June Lake resident deputy. Over the past years, the website says he has worked a variety of assignments with both departments, ranging from field training officer, dispatcher, special assignment deputy, helicopter observer, sergeant, lieutenant, and chief deputy coroner. He was promoted to his current rank of undersheriff in January of 2008. Well, a press release from Inyo and Mono County Health Officer Rick Johnson notes significant increases in flu activity in the United States have occurred in the last 2 weeks, indicating that an early flu season is upon us. Now, these increases overlap with the National Influenza Vaccination Week, and that is being observed through December 8th. Now, Dr. Johnson says this should be a wake-up call for anyone who has put off getting the vaccination. The time is now. Now, according to local, regional, and national public health reports, all but 2 states have already reported laboratory-confirmed cases of influenza, and the percentage of tests turning positive is rising fast. Now, influenza activity in parts of the country is already higher than of all of last season, with 5 states reporting the highest level of activity possible. These indicators, according to Johnson, are the highest for this time of year since the 2003-2004 season, which was early and severe, especially for children. Now, last season, which was mild and late, the U.S. did not reach a peak until mid-March, a month later than the usual in February. Now, flu activity, according to the press release, is most intense in the south central and southeast part of the country right now. However, it is showing signs of increasing across the country as well, including in California. Thus far, there have not been any documented cases in the eastern Sierra. The press release states, certainly there has been a lot of illness in our midst this fall, just not the real influenza. The bad news, most of the viruses identified so far this season in the U.S. have been type A, which are typically associated with more severe seasons. The good news, most of the viruses are well matched to the viruses in this year's vaccine. Now, with increasing flu activity and family and friends gathering for the holidays, now, according to the press release, is a great time to get a flu vaccine, which takes about 2 weeks to work. Vaccine is plentiful this year and available from your local healthcare provider, pharmacies, and your local health department. We'll be back with more news.